Hey everyone, welcome to the Pumpkin Spice and Healthy Knees Fall Fitness Tips to Avoid Knee Pain. My name is Dr. Alex Tam, and I'm so excited with you today to go over this amazing webinar that I'm going to be sharing with all of you. Now, before we get started, think about all the people that you care about who have had knee pain. Maybe you yourself have had knee pain and it's something that you've been suffering from for years and months. If you know people who've been suffering from knee pain and they could not attend this webinar, make sure you tell them about it next time and let them attend the next one. Or when this webinar comes out, you absolutely have to share the webinar with them. So who am I? My name is Dr. Alex Tam. I have a Bachelor of Science degree from UC Davis in exercise biology. Now, I've also been the clinical director at Absolute Integrative Physical Medicine for almost 16 years now, 15 and a half going through 16, and we've treated over 10,000 patients. That number is creeping into maybe even over 15,000 now. Our mission is to help patients with chronic pain get their life back without harmful drugs or unnecessary surgeries. So welcome to the first month of fall. Really, if you're depending on when you're watching this could be the first week of fall. Fall is a season that brings cooler weather and plenty of outdoor activities. So it's especially important for senior adults, older adults to focus on knee health to maintain an active lifestyle. This is what I help patients do, is maintain an active lifestyle. Did you know that nearly 50% of adults over 65 years old experience some form of knee pain and stiffness, especially in colder months? I would guess in colder months, that number is close to 80%. With the right fitness tips, you can stay active and enjoy the season without any discomfort. You ready to dive in? Well, let's understand how aging affects the knee. First off, we need to look at some anatomy and the mechanics. The knee is the largest joint in the body, connecting your thigh, the femur bone, to your shin bone, the tibia. I mean, if you look at it, it's a big old joint. There's cartilage cushions the bones, while ligaments provide stability for the bones above and below. If you look at the knee joint, there's multiple different ligaments. Just the quads alone is 4 different muscles that help support the knee. But over time, the knee can have wear and tear, and cartilage can lead to stiffness and pain. Now, common age-related knee issues is osteoarthritis. This is the most common cause of knee pain in older adults, where the cartilage starts to wear down, and between the bones it starts to eat away the cartilage, the meniscus, and there's obviously wear and tear. Osteophytes can come on, bone spurs can come on as well, and it can cause a lot of problems. Joint stiffness is another one. As we age, the fluid that lubricates the joint starts to decrease and the cartilage becomes thinner, leading to stiffness. Reduce muscle strength. As we get older, after the age of about 35, we tend to start losing muscle mass faster than we're gaining muscle mass. And a lot of people over 65 don't have the right muscle mass for the knee because, well, a lot of people are sedentary and do not exercise and walk as much as they should. So over time, the knee joint can start to wear down. Strengthening exercise and maintaining flexibility will slow the progression of these processes. So why does the knee worsen in colder weather? I'm going to give you 3 things. All right, starting from the top, you have temperature. Temperature dropping in temperature reduces the amount of blood flow because colder weather, less blood flow. It's just like warmer weather, higher blood flow. Barometric pressure changes. During the colder season, you may have lower temperature outside than the inside. How many of you have ever said, I feel like the weather is changing, my knees and joints are hurting, the weather is about to change, it's about to rain, clouds are coming. That's because when clouds come, you usually have lower temperatures and lower pressures. And the lower pressure causes the joint to expand. The higher pressure in the knee, lower pressure outside, the air is trying to escape out there, and it's causing extra pressure on your knees. So you feel it in the knees, ankles, and places that you've had injuries before. Less activity. In general, colder months, you're going to have less activity in general, which means more stiffness, less blood flow, and less muscle around the knees. So once again, staying active is key. Now, here's some common fall activities that may cause knee pain, things that you might not even think about, right? Raking the leaves and gardening. Well, we think that, oh yeah, it's just low impact, light activities, raking leaves. But there's a lot of bending, squatting, lifting, puts a lot of strain on your knees. You're climbing up ladders, trying to trim trees before the winter starts. Prolonged activities, you're staying out there sweeping leaves. Sometimes the leaves are wet, they're moist in the morning. Slips, falls happen a lot more during the fall and winter months than they do the summer months. There's a reason for that, right? Now, here's some tools to prevent bending as much. Maybe look into using tools with longer handles, right? Take frequent breaks. Try sitting on a bench when you're gardening, or using some knee braces and kneeling, right? So these are things that you need to do to prevent knee pain in the long run. What about, well, I thought low impact sports were good. Low impact sports are good, but a lot of times we have sudden movements and that can cause knee discomfort. We're not warming up the right way, and quite frankly, because they're low impact, a lot of people end up overdoing it, and that causes the knee to have problems. You risk knee strain in the long run. So you have to focus on slower movements, gentle warm-ups, and you have to warm up. Not warming up the knee causes problems with your hips, lower back, all kinds of issues in the long run. So, seasonal walks or hikes. Well, how is that bad? It's okay unless if you're walking on uneven terrain, a lot of hills are slippery, that causes more pressure on your knees going up and down steps, which leads to more pain and injury. Slippery leaves, wet ground, like we mentioned before, during fall hikes can add to the risk of falls or twisting your knees. So how do you counteract this? You wear supportive shoes, consider walking aids like a trekking pole, maintain balance and extra pressure or reducing pressure on the knees. Fall fitness tips to keep your knees strong and healthy. So we talked about low impact strengthening exercises, right? Chair exercises. Think about sitting down, using your leg raises to help strengthen the knee muscles. Wall squats, stationary cycling. These are all good exercises that you can do indoor to prevent outdoor pain and activities. Maybe you don't want to go for a wet hike in the morning. Do some of these exercises in the evening or indoors. Start slow. You have to start slow. You gradually increase your intensity over time to prevent injury. That seems like a common theme here. Starting slow and also warming up. All right. Here's the next one. Walk right into it. Gentle warm-ups and stretching. Now, why is this so important? Because warming up helps increase the blood flow, reducing stiffness, which reduces injuries. Stretching prioritizes the gentle stretches that target the hamstrings, quadriceps, and calves to keep your knees very, very flexible. Examples: sitting down, leaning forward, stretching your hamstrings, sitting on a chair, putting your leg up, right? Extend one leg in front of you, heel on the floor, and gently reach for your toes. It's not that hard, but it's something that we do not do, or not enough of you do it, right? You got to admit, I think the first key is to not be in denial, right? Admit that, yes, you're at fault, you need to do more, and then you go do it. Because if you say, well, it's not that bad, or I've been doing everything that you've asked me to do and I'm still having problems, well, maybe you're in a little bit of denial, maybe, right? Now, pacing and rest. Listen to your body. It is essential, and I mean essential, to not overdo physical activities, especially when your knee feels like it's in a lot of discomfort. You got to take breaks. Whether it's gardening, biking, walking, exercising, incorporate regular rest to avoid putting too much stress on your knee. It's like a car. You keep revving it at 8,000 RPM. Eventually that engine's going to break down. So does the knee. You have to set a timer. Remind yourself to take breaks during any activity. We had a patient just here today. end up doing yard work for 6 hours at a time, 0 breaks, wondering. Well, she wasn't wondering, but I said, well, that's why the shoulder becomes a problem. The hips becomes a problem. Everything's achy. That's because you were out there for 6 hours at a time. Anyone being out there in the yard 6 hours at a time was going to have problems. All right. Here's some tips to avoid knee pain in the fall. Extra tips. Wear supportive shoes. We talked about supportive shoes, walking outside, make sure they're grippy. Well, why is that important? Because wearing shoes with the proper cushioning in the arch can also help absorb shock, reduce the stress on your knees, especially during outdoor activities. What do you look for? You want shoes that have good arch supports, good cushioning, good heel support, and it doesn't have slippery soles. Don't pick up the shoes that have it's completely flat soles. Those you will slip. You don't have enough grip on there, especially in wet leaves and in uneven ground. And please, replace those worn out shoes. I see some patients who like to keep shoes for years and years and years, but not realizing that they're breaking down over time. They're not giving you the right support, and then you end up with more knee pain. Use knee braces and compression sleeves if necessary. Say if you're going out, you're going to be out there for a while, this could be a time to use a knee brace or a compression sleeve to stabilize that joint, to mimic that joint to be a little bit stronger because they have a protective mechanism. But you cannot rely on this. This is not something that you rely on long term. You might be able to wear it short term for a certain activity, but do not wear it long term. All right. During walks, gardening, different activities, it puts a little extra strain on the knees. Start using them. Okay. Maintain proper posture and mechanics. I cannot say this enough. When the body starts to lean forward, it puts extra stress on your knees. And same thing, anytime your body goes off vertical one way or another, forward, backward, left and right, it's going to put more stress on your knees. Bending, twisting, lifting also puts extra stress on your knees as well. Make sure you practice lifting objects with proper mechanics, right? And when you're walking, focus on maintaining upright posture to minimize knee pain. Use long handheld tools, right? Long handle tools to reduce the stress of bending all the time. You have to stay active, but you have to make sure you do not, I repeat, do not overdo it, right? Why is that so important? Not because regular activity strengthens muscles around the knees, but overexertion can lead to more knee pain and knee problems. So incorporate gentle, consistent movement into your routine, such as walking, stretching, and light strength exercises while avoiding activities that causes discomfort, right? Aim for moderation. Staying active, allowing time for rest and recovery, it's key. Now, what are some at-home things? You might think, well, Dr. Tam, I don't like going out. I like to do things at home. You have to alternate between heat and cold therapy depending on where the problem is. If you just hurt your knee, yes, to prevent some swelling, you could put some cold therapy on, elevate. But if it's a chronic problem, it might not be so good to use cold. That's where I usually will recommend more heat. Now, consult with your healthcare providers on what to do before you actually do it, right? Never use cold or heat therapy for more than 20 minutes because the reverse starts happening. It starts getting worse again. So you never want to do that. Elevate and rest, because when you elevate your feet towards your heart level, you allow blood flow to flow better. You allow rest, take less pressure off your feet, off your knees. That's why it helps, all right? Don't do it for more than, say, 20 minutes again, maybe 30 minutes, because then you become too sedentary. You got to keep moving here, all right? That's the goal. How about some stretching and massages? People always ask me, well, Dr. Tam, how much should I stretch? How much is too much? Well, here's the thing. When you are stretching, the moment you feel a stretch, you need to stop and wait. 20 seconds, 30 seconds, a minute. Don't stretch even more, because if you overstrain yourself, some other area in your body is going to give way. And now you've strained your body or sprained something when you really didn't need to. So make sure you have gentle stretching. Massages can also help to loosen up the area. to also bring more blood flow to the area as well. Now, when should you consult a professional? You got to know the signs. If your knee pain persists more than a few days and even a few weeks, and it starts to get worse over time, and it's accompanied by significant swelling, instability, maybe you feel weakness, you're feeling tingling in your toes when this is happening, this is the time to consult a specialist, a healthcare provider, for further evaluation and treatment. Remember, early intervention can prevent more serious knee injuries down the line. So early intervention is key. Conclusion: you want to step in the fall with confidence? Well, here's the recap. And here's my takeaways. Number 1, stay active. Gentle exercises and stretches, right? Modify activities. Common fall tasks, you got to modify them. Like raking, walking, reduce knee strains, okay? Wet leaves and improper shoe wear. At-home therapies, cold, heat therapy, massage, stretching. These are all things that you can do and start doing today. Now, how do you keep your knees healthy this season? Don't let knee pain, once again, get you and hold you back from enjoying this beautiful fall season, especially the fall leaves. They're coming earlier than ever this year. With the right approach, you can stay active, healthy, and be pain-free. I just want to give a shout out to our office staff because they do phenomenal work with patients with knee pain. If your knee pain consistently happens, well, let us know. Let us know when things like this happens, and let's stop taking just medication for knee pain or covering up the knee. Seek out help from a professional. If you're in the Vacaville, within a 2-hour drive from us, we help a lot of people with knees from usually within a 2-hour drive. All right, I hope this helps. Thank you so much for spending time with me. I really enjoy doing these webinars every single month to give you more value on what you can do to improve your life, less pain, and increase your longevity. Have a great day, guys.